One of the fears of first aid will be fear of putting your mouth down onto somebody else's. Fear of getting infection, fear of getting involved within CPR within that level. It may be this person has vomited. It may be you're doing normal CPR and now their face is covered in vomit, it may be blood on there, and you haven't got a face shield, you haven't got any protection, and you just don't want to put breaths into the mouth. This is not a problem. What you can do is you can do what's called continual chest compressions or chest only CPR. Within this, what we're doing is we're still doing the compressions, so we're doing continual chest compressions, but that's it, we're not just stopping at 30, we're just going to keep going. What you might find, it's much easier just doing continual chest compressions because you're not bending over to do the breaths. Now, when we're doing normal CPR, we're doing 30 and 2. Now, it doesn't really matter if you do 40 and 2. Now, I know the guidelines say this, but it's not really a major problem. Because if you're doing compressions with something and then you need to talk to someone, we'll just keep going with these compressions. The vital thing is, if you're not doing compressions, you need to be doing breaths. So if you need to talk to someone, just keep on doing these compressions. So continual chest-only compressions, we're still using the same part of the hand, we're still interlocking the fingers, popping it straight onto the chest, and we're then delivering the compressions exactly the same way, pushing down on the chest 5 to 6 centimeters, completely releasing so the heart's got full chance to recover and fill up with blood, and pushing down. We're still doing this at the same speed, 100 to 120 per minute, which is nearly 2 a second. And we just keep on going, and we keep going within that. It is something that you can practice, or if all else fails and you're out and about and you don't want to get involved in the face, then this is the thing you need to do. One thing people say is, well, if I'm just doing chest compressions, does that mean they're not getting any air? Well, in their body right now, they'll have oxygen within the blood already, so you're still pumping this oxygen around. Also, when we push down on here, we're also pushing down on the chest. When you're breathing, you're typically breathing in and you're breathing out. Well, when you breathe out, there's still loads of trapped air in your lungs. So when we push down on the chest, we're actually forcing air out of the mouth. When we let go, we will suck some air back in. So there will be an element of airflow every time you do the compression. Twice a second, you'll be pushing down and there will be some airflow in and out. This is another way that we can get air in. And with normal CPR, we're breathing in 21% oxygen and we're breathing out 16%. Your body uses about 5%. Within chest-only compressions, when we push down, we force the air out, we let out, 21% oxygen is going to be going in. So this will be a benefit for the patient. Not as effective as full breaths, but still good. So if you're worried at all about doing CPR, or you're handing over to a second rescuer and they don't want to do their breaths, or they don't want to share your face shield, get them to do chest-only compressions. Chest-only compressions will save this person's life if done effectively, and if they're very lucky and they get the AD in time and they get other care. These are easy, simple ways to help to try and save someone's life.